Welcome to Overdose Prevention 101. My name is Merlene Tucker, and I'll be running today's web forum along with my colleague Jeff Bornstein. Today's web forum is sponsored by the National Overdose Prevention Network, a program of PHI Center for Health, Leadership, and Impact, and produced by Dialogue for Health. It's time to meet the moderator of today's event, Amy Max. Amy is a senior program manager at PHI Center for Health, Leadership, and Impact, where she oversees the design, strategy, and continuous quality improvement of multiple public health programs and initiatives. She currently manages operations for the center's overdose prevention portfolio, including an annual accelerated program for local overdose coalitions and the National Overdose Prevention Network, which provides training, resources, and learning opportunities for more than 6,000 leaders nationwide. Welcome, Amy.
Thank you so much, Merlene, and thank you to everyone for joining today's webinar. We are super excited to introduce our new Overdose Prevention 101 guides, which are now posted on our website at nopin.org. Before we begin, I want to make an announcement. If you go to the next slide, our team at Nopin is proud to co-sponsor the upcoming National Overdose Prevention Leadership Summit, which is coming up on November 16th and 17th. This year's summit is free, which is really exciting, and will continue to be held virtually and feature a wide range of excellent speakers from across the country, spanning public health, healthcare, and the justice sectors. So you can go to overdoseleadershipsummit.org to learn more about that upcoming event. And now let's move into our learning objectives for today. First, we want to make sure that you understand the purpose of our new Overdose Prevention 101 and Rural Resource Guides and how to put them into practice. And then we will dig into the guides themselves and highlight some of our signature tools and some case examples that we have linked within the guides. And then at the end, we'll share a bit more about our work here at Nopin and how you can stay involved. So we made both of these resources, a general 101 guide and a rural specific one, to help meet several needs. First, we wanted to provide a useful starting point for those who are new to the field of overdose prevention. This is a growing field, and you might either be new to it yourself, or like I said, you might need a tool to help you onboard and train either your colleagues or other members of your community. So whether you are a public health professional, a clinician, a community health worker, substance use navigator, a community advocate, or anyone else involved in overdose prevention, we made this guide to help provide a foundation to help you and others get started. And the guide also provides a helpful framework for how to drive systems change in your community to promote overdose prevention. So we'll dive into this soon, but our guide is organized to help you think not just about effective intervention strategies, but also how to organize yourself and others in your community to be as efficient and effective as possible in your response efforts. This includes tools and strategies for building strong partnerships, methods for using data effectively to maximize your impact, and guides to build a strong communications strategy to amplify your message. Another goal we had in making this guide was to help synthesize the overwhelming number of available resources. So our own resource library has hundreds of resources on our website that you can use in your work. But these 101 guides include a consolidated list of the tools and resources we think are the most important for those working in the field. It also provides a one-stop shop web link that you can share with your colleagues and members of your community. And we'll be updating it over time and are always open to your feedback as we continue to develop these guides. So let's go to the next slide and we'll take a look at how the guides are organized. In both the general Overdose 101 and the resource version of the rural version of the guide, we organized content based on our model for creating systems change in overdose prevention at the local level. And this is a very similar model, parallel model that we use for all of our work supporting community-based health efforts through the PHI Center for Health, Leadership, and Impact in the communities we work with across the country. So the diagram you see on the right shows the 5 core components of our model. In the center, you see those 2 overlapping circles. one for coalition building, and one for overdose strategy implementation. And we believe that these are equally important for driving systems change within communities. It's essential to have evidence-based strategies at your disposal, including effective naloxone distribution, access to medication-assisted treatment, and harm reduction services, for example. However, it is equally important to focus on coalition building to ensure that people and organizations within your community are working effectively together and in partnership to sustain these changes over time. So that's why we offer a number of focused tools and resources within our guides that are all about building strong partnerships, setting a clear vision, and having a strategic focus. On the outside of the circles, you'll see the three other core areas of our model around the outside circle. As you'll see in the guide, we have specific sections focused on communicating for impact to make sure you have a grounded understanding of what it takes to have strong messaging to support your goals and reach your target audiences. We also have sections focused on measurement to help you use data in a strategic and actionable way. And then also sections on sustainability to make sure you think about methods to set the stage for long-term impact in your community. So with that, I'm excited to give you a brief look at the guides themselves, and then my colleagues will showcase some specific examples of tools and resources that you'll find within the guides. So let's go to our website, www.nopin.org. And these are linked up on the homepage of our website and also within the resources menu that you'll see. And you'll see the link to both guides. And we're starting here with the General Overdose Prevention 101 guide. So again, these are really built as online web links. So they're easy to share with other members of your community and colleagues, and that we'll be able to update them over time. So you can always go to these same URLs to find the guides. You'll see at the top, there's a menu with the different sections of the guide. So we start with basic definitions of substance use disorder, and we have a section on core terminology. Let's click on the overdose prevention strategies section. And here you'll see a basic description and a list of strategies, and then corresponding links down below to what we think are the most helpful resources related to each one. So prevent new addictions, managing pain safely, treating substance use disorder, and stopping overdose deaths. And some of our resources are tools that our NOPIN team at the PHI Center for Health Leadership and Impact have developed. And others are links to external websites and resources. And we've also included within here links to case examples, so you can see how communities are approaching overdose prevention across the country. And later in this webinar, we'll showcase examples of some of those case studies that you can learn from. So now let's go to the rural guide. And again, with our rural guide, we have kind of those chapters or menu bar that you can see up at the top. And this one's a bit different in that we've customized the resources and case examples to focus on the specific context of working in rural communities. And again, we've also included case examples throughout the guide to showcase how overdose prevention has been put in practice within rural communities across the US. So let's click, for example, on stigma. We have a whole section on stigma. And just with the main guide, again, if you scroll down, you'll see a basic definition, and then you'll see related resources, the consolidated list that we think are some really helpful tools and resources related to battling stigma as it relates to substance use disorder. So with that, I'd like to pass the mic over to my colleague, Veronica Johnson, and she's going to dig into a few of our signature tools designed by our team here at the PHI Center for Health Leadership and Impact that we've highlighted within the guides. Take it away, Veronica.
Hello, everyone. So glad to be here with you all today and to be sharing these resources. If we can go on to the next slide. And I'm just going to review some of our core tools and examples. These are also embedded in both of the different guides that we have under the different categories that we think they're the most important. But I'm going to just highlight some of the ones that we think are really, really critical to the work and ones that we provide with our accelerator program here in California. If we can go to the next slide, please. So what are those core tools that I'm talking about? First, we have our partnership mapping tool, followed by our health equity tool, our COPE and measurement guide, our partnerships and action page within our website, and then our trending topics page also within our website. I'm going to go ahead and screen share right now, so that way we can show you those different resources. So let me get back to our website. So the first one that we had discussed was the partnership mapping tool. When you see the slides later, or if you go onto our website right now, this is what it'll look like when you first go onto the web page. You'll see the partnership mapping tool, an option to be able to download the guide, and I'll show you that in a second what that looks like. But also want to highlight, I'm not going to be able to review this tool in its fullest form with you all, but we do have this great video. It's short, less than 5 minutes, and it's able to be able to walk you through all of those different sections and how to use the tool to be able to apply it to your community. The purpose of this tool, and I'll go ahead, when you click download, it'll send you to this link over here, showing you the partnership mapping tool, starting off with our partnership wheel. This is what you'll see a lot of the time that we reference, but this is to be able to give an overview of the types of partnerships that you should have, whether you're working in a coalition or trying to establish a coalition, and it has different parts that allow you to be able to evaluate and assess where you're at within your coalition and within the overdose work that you have going on within your community. You're able to also dive in a little deeper with some of these facilitated questions for you. And as multiple pages, you'll be able to see here, we have 6 different pages and it breaks down the different pieces of this guide. Moving along quickly, just to be able to go over those other ones that we have for you, are the health equity tool. Similar to our partnership mapping tool, this health equity tool is really pivotal to the work and something that we really try to uplift as a really great guide for you to be able to center health equity into your overdose prevention work. Again, we do have a short video. This one's less than 4 minutes and provides you a little walkthrough of all the different pieces of the tool, how to best use it, and hopefully answer any of those questions that you might have. You'll be able to go ahead and click download again. It'll take you to the document one more time. Let me start it from the beginning for you all. Has a little bit of an intro, talks about your impact statement with some guiding questions. And really what I like to highlight in this tool is the socioeconomic, political, and cultural context. This is really getting into the why and the purpose of having a health equity lens into your work, and then also the rationale, and then the next section's key activities. We'll be able to break down a little bit more on how you can implement those with these different guided descriptions and questions for you. Moving along to the next tool that we wanted to highlight was our COPE and measurement guide. Saw a lot of West Coast attendees in the poll earlier, but want to call out that this measurement guide is also a best practice guide and can be applied to different communities as well. It is geared for our California audience with different resources here in California, but just also want to be able to highlight that you don't have to live in California for this tool to be applicable to your work. If you go into our content section, this highlights the different sections that we have going on. You can go ahead and click it and it'll be able to navigate you, jump down into those different sections. But as I said, it has lots of different pieces that you can apply to your work, no matter where you're at in this country, talking about health equity and measurement, how to include all these different pieces and components, and has lots of descriptions for you to be able to really dive in deeper about how to do best practice within your data work and your measurement work. It does have different national databases for you to be able to reference, but it also acts as a workbook. I used this when I was actually in coalition work before my current role. And you can go ahead and start wherever you'd like to, but really you're able to start from the very beginning if you're brand new to this work or brand new to data and measurement. That's what I really like about this one, is it acts as a workbook and not just a reference book. It can be used either or, but really breaks down all the different pieces of data measurement and application, from collecting the data to then being able to narrow it down, and then how to communicate that with different audiences. As you can see, there's lots of different pages here, and so I won't be able to go through the entire guide with you, but I highly recommend you look at it when you do have the time to. The next two portions are just pages within our own website. So the way you'd be able to navigate this is within resources, and we have those different sections here are curated resources. These show different partnerships in action, and what we mean by that are some different sectors of the work, highlighting some case examples, some pertinent tools, and then also any sort of webinars that we've had in the past. So just showing you, we have behavioral health, faith-based, harm reduction, healthcare, higher education, justice, law enforcement, pharmacy, and youth engagement. To show you what it looks like when you click on one of these, if we click on harm reduction, you'll see some of our webinar recordings that we have that are related to harm reduction. Here we have ones that are highlighted with our faith-based communities and harm reduction, our youth overdose prevention, meeting some of our partners. So we have here Laura Guzman from the Harm Reduction Coalition highlighted with some more information, as well as those related resources. And this can work as a really great guide and example for you to be able to further look into all of those great resources we have within our website that are a little bit more curated or related to the different sector or partner that you're looking at. And then our last section that I'm going to review with you is our trending topics. This section we try to update as frequently as possible with different trending topics that are going on within overdose prevention and substance use work. Here we have some of our COVID-19 resources, followed up with fentanyl. It follows the same formatting that we have for our guides that we're presenting you today, with a little bit of a description as well as those related resources. Here we have fentanyl testing strips, national opioid settlements, stimulants, trauma-informed practice, and youth engagement. So just wanted to be able to highlight these for you all, and I'm going to stop screen sharing if we can pass it back to the slides, and I'm going to welcome Mary Maddox Gonzalez, our Copen Impact Coach, to be able to describe a little bit more of those case studies with you that we had talked about earlier with Amy, and to talk about what NOPEN can do for you.
Thank you very much, Veronica. And I want to add my welcome to all of you who are joining us from across the country. So we are going to go over some of the case studies that have happened over the last several years, with particularly the last couple of years in our California Overdose Prevention Network. Could I have the next slide, please? So you'll see there are links when you get the slides, which will be available to you. These are all links to the guide. So I'm just going to select a couple of them. So the first one we're going to talk about has to do with harm reduction. Could I have the next slide, Veronica, please? So in the area of Northern California, the Butte, Glen counties in that area, they were very focused on assuring an array of things, using the framework that you've heard about, looking at these different overdose prevention strategies. But this one was of particular importance to them and many of our coalitions, and that's harm reduction services in jails. They were particularly concerned about ensuring that individuals released from jail had access to naloxone. We know that it is just a period of extremely high risk of overdose when somebody has been in jail, has not been using, and then is released. It's 10 times the risk of the general public in those first couple of weeks, 8 times what it is for an individual 3 months to a year later. So really important that this be done. And through their coalition, they established a relationship with their sheriff's office, with other local law enforcement, and had resistance initially. We've been doing this for about 5 years, with the coalitions. And it was a pretty solid no initially. And we have seen with the partnerships with the coalitions, with the trust that's grown, and with the evidence that the information that people are receiving, the local data, there was a willingness, and they were able to get agreement that the local jail would provide naloxone on discharge to all inmates. What's interesting too is this was sort of an initial, we've seen in multiple areas of the state where this is kind of an initial strategy that then went on from there to allow individuals an agreement for the individuals who are on treatment would be continuing their treatment while they were in jail, and then fortunately initiating treatment. medication-assisted treatment in jails. So it's really been a very gratifying and very effective increase in harm reduction from the naloxone on release to actually implementing treatment, initiating treatment in jails. The next example I'd like to provide is another harm reduction strategy. And this was in San Luis Obispo, which is kind of on the coast in the central area of California. And again, they were very interested in expanding access to naloxone, but they realized that, for example, it might be available in at a syringe exchange program, or it might be at a health fair, or multiple areas. But because of stigma, there was a lot of reluctance for people to go and obtain naloxone. So what they developed, they entered into this really great partnership, looking again at their local circumstances, with a California State University in their area called Cal Poly, and they have a digital transformation hub. And so they helped them to set up a phone app and a website where people can go and anonymously obtain free naloxone. It can be mailed to them, or if they prefer, they can find out where they can get naloxone in their community. This website also has a brief training on how to use naloxone, and has really helped to expand access to naloxone in that community. The other thing I wanted to highlight, and it's kind of here on the right side of the slide, one thing that we really encourage all the coalitions in the work is to make sure that people with lived experience are engaged, community members are engaged, and whether it be data, a campaign, whatever it is that is going to be used in the community, that we do ground truthing on it. You know, does this ring clear to members of the community, to those with lived experience? So this is a good example. They took their initial thought on a slogan, which was "Overdose happens, but it doesn't have to happen to you, be prepared." Well, people didn't like the fact that it said "you." That was off-putting to them. So they switched to "Overdose affects us all, be prepared." So that really making sure we have individuals with lived experience and community members involved in all aspects of these overdose strategies is really, prevention strategies is very important. Next example I wanted to provide has to do with engaging youth in overdose prevention. There's just a really exciting group called Empower Watsonville. And Watsonville is an agricultural area in California. It's a predominantly Latino community. And the Empower Watsonville is a youth-led and truly youth-led organization that is involved in a number of things, including youth leadership development, but they have a focus on trying to inform the community about how they can prevent overdoses and really implement policies. So they've been so effective. They decided they really had to know the baseline. What is the experience of local youth in terms of their exposure to substances, to drugs? And so they developed a survey, a point-in-time survey, and then they administered it. So they had a very high response rate because it was youth talking with their peers, doing this anonymous survey. And they got both qualitative and quantitative data, and were very effective in combining this. One example of this is, they had kind of a standard bar chart of, what age were you exposed to drugs for the first time? And then they captured on the side a quote from one individual saying, "Well, I wasn't sure how to respond to this because I didn't start taking drugs till I was 14, but I saw my uncle shooting up when I was 8. It gives you a whole different perception of what the reality is of the youth. So they've used this data very effectively. They analyzed it, a lot of it using the instruments that we were talking about, the measurement guide. And then they have taken this information, and the youth themselves are working with their school districts, with their community, to change policies. They're also bringing this information to their parents, including some of the events they've had have been in the fields. Many of the parents are farm workers, so they've actually gone to the fields to provide this information. And they are really using this to implement more of a restorative justice approach to with youth who are found to be possessing drugs or under the influence in school, and linking them to resources. Very exciting survey, which is available. The actual survey is available also as part of the overall guide that we are providing to as the 101 guide. The next example that we wanted to talk about is Let's Talk. One thing that's been very successful, we've had some counties that are, rather than having their own individual each county having their own coalition, have joined forces, because in those situations, it's really how people live. You know, often these jurisdictional boundaries are artificial relative to how people live their lives. So these are 3 counties: Monterey, San Benito, and Santa Cruz. And they looked at the data locally. They realized that high school students had easy access, opportunities to using drugs. And given this reality, they said, what are we going to do to make sure that parents are equipped to have conversations with their youth, parents and caretakers, frank conversations with the facts about drugs, and included how to discuss the information, talked a lot about mental health issues also, and very importantly, also emphasizing the importance of listening to youth. So they have done this. They've distributed to all the youth who are made available to all youth who are high school age. And then just a couple of months ago, they have released Let's Start Talking, that is focused on middle school aged youth. And that's been very, very welcome, much welcomed in the community. And one thing overall with that I love about the Overdose Prevention 101, use all this, adapt and adapt. We want the information to get out there. This is about changing systems. This is about really movement building to address this very important issue of overdoses. Next example I wanted to talk about is a really exciting one that's happening initially started in California, maybe in other states too, but here in California, it started in Contra Costa County, which is kind of the Bay Area portion of the state of California. There, the emergency medical services is such an important response. Every community has emergency medical services. Sometimes it might be volunteer fire departments. It may be highly sophisticated emergency medical services agencies. And the EMS includes a cadre of highly trained paramedics, emergency medical technicians. They are on the front lines of responding to overdoses. And this model is making them not only, has introduced not only responding to overdoses, but actually being part of the initiation of treatment for substance use disorder, for opioid use disorder. So what they have started, and this is now, there are other counties that are beginning to do this, is providing, when they go to respond to an overdose, how they can actually provide, initiate the medication-assisted treatment in the field. So if you can just scroll down a little bit, Veronica, on this, you'll see that there is 4 parts to this. They actually do the buprenorphine initiation in the field. Then critical is linking that individual through public health, where they have substance use navigators. These are individuals who are based in local hospitals. They've highly trained in patient engagement, linking to ongoing treatment. So they respond within 72 hours to that individual to try to facilitate their continuation in treatment. They also make sure that there is Narcan and naloxone available in the community. We hear a lot about Narcan, but naloxone and injected naloxone is very important also. And then they have an overdose receiving center where people, once they are in the field, they're taken to the emergency room. And this excellent program, California Bridge, really provides has individuals in the hospitals, emergency departments. First, the clinicians who are providing the treatment, and then also these substance use navigators. And that's been highly effective. Right now, the majority of hospitals in the state of California are part of this California Bridge. And, the great thing about this, the Overdose Prevention 101 is, this is one resource you're going to see. But if you dive deeper into California Bridge, you'll see at the top, it has amazing tools. It has fantastic clinical protocols. So you don't have to start from scratch. There is a lot out there that you can be using. Great, thank you. And then one last example I wanted to provide that is included in this is what is this very effective campaigns that are being conducted in different parts of the U.S. This is one that's Shatterproof is an organization that is focused on substance use disorder and addressing stigma. Stigma is such an important issue that prevents people from getting the treatment they need. There's stigma about substance use. There's stigma also about harm reduction. And it is a major barrier to preventing overdoses. We know that currently only 5% of people who need access to treatment actually access the treatment. 95% don't. And a major issue in that is stigma. So this type of campaign is very effective. This is, as I said, Pennsylvania and Kentucky. What they've seen is when they've done these campaigns, people recognize how serious the problem is. Very importantly, they recognize that medication-assisted treatment is effective, that there is something that can be done. And they learn that there are important things that can be done in harm reduction to keep people alive. And that's a major shift in many places. We know that from studies that the stigma is even greater in rural areas. So they've done a lot to focus, particularly in rural areas too. This one, as you see in the Kentucky one, which you can see it's Unshame Kentucky is the name of the campaign, but what they say is most Kentuckians know someone with an opioid use disorder. At this point, almost all of us know someone with an opioid use disorder. So we know that if people hear stories about individuals, if addiction has a face, you know the person through the story. You hear stories of recovery, you hear stories of treatment and recovery. This has the ability to reduce stigma, to really shift the perceptions of individuals about substance use, making them realize that this is a chronic disease and that it needs treatment like any other chronic disease. So these stigma reduction campaigns are very important. So these are just some examples of what is available in the Overdose Prevention Guide. And we hope that you will look at all of these and the additional ones. I'd like to just go to a couple more slides that just an overview of the National Overdose Prevention Network. And if you aren't a member, we hope you will join because there is the resource we're talking about today, and there's much more. Could I have the next slide, please? So our focus is on providing strategies for overdose prevention. And these strategies are both, big picture, like the framework. How do you approach this? Looking at those kind of 4 areas of preventing addiction, looking at harm reduction, managing pain, all of these that's one strategy that Amy went over, how we look at coalition building, the actual strategies for overdose prevention, and how all of that together brings systems change about. Best practices, we've been talking about those, the absolute essential nature of partnership in addressing this very complex issue, how we go to move policy, because we know that we can work on a one-to-one level, we can work on a community level, but when we affect policy and legislation, that's how we have the greatest the impact on the largest number of individuals. And they're very important, sustaining this effort. This is a marathon, not a sprint. how do we sustain the effort from all the perspectives of that are so important to make sure that this is effective in the long run. We do have our the link there to our website. Could I have the next slide, please? And this is how you can get involved in NOPN. We have a monthly digest. You can subscribe to that. It has up-to-date information on funding opportunities, a lot of resources, webinars, other events. We would love to have you join our webinars and let other people know. Again, we're trying to really, it's a movement. And then the resource library is very extensive, and you can kind of go to whatever level you want on that, the general information, or dive deep. And then very importantly, as Amy mentioned, November 16th and 17th with the National Overdose Prevention Leadership Summit. So we hope you will join us for that, and it will be free this year. Could I have the next slide, please? Great. Well, I'm going to turn things back over to Amy Max, and we're going to have an opportunity for Q&A.
Wonderful. Thank you so much, Mary. And always so wonderful to hear the really concrete case examples from the work happening on the ground. And again, those case examples are linked within the guide and also up in our resource library. So everything at your disposal. I'm seeing a couple questions coming in the chat, but please use the Q&A, folks, if you have anything else you want to share with us. And in the meantime, Veronica, if you wouldn't mind putting back up the homepage, I just want to make sure, I know we've been sending a lot of links and going through a lot of information. Just want to make sure it's very clear to folks of where to find these guides. So if you go to nopn.org, you'll see up there at the top, new resources. If you go up at that blue bar at the top, yep, there's the Overdose Prevention 101 guide and the Overdose Prevention Rural Communities guide. You can find it there. You can also go to where it says resources on the right there, and you will find the Overdose Prevention 101 and Rural Communities guides there as well. So please do share those on your listservs with coalition members, post on social media. Please do share them in your community, and we will include them on our digest. And then for folks who are on our digest, if you scroll all the way to the bottom, Veronica, you can show them where we have that form for people to sign up. And again, you can also spread the word to get others to sign up. So just go to the bottom of our website, and this is how you can get on our monthly digest list. So make sure you are signed up so that you know about the webinars that we're hosting every month, and other resources and opportunities that we want to make sure we share with our audience. Okay, a couple questions here. Is there a branch of NOPN for every state? No. We are the largest overdose prevention network that we know of supporting this type of work and this learning community. We did start off with our work here in California, which we call COPN, and given the success of the learning model here for our folks in California, we did decide to create this national learning network. So there's certainly amazing work happening across the country, but not quite what we're doing with this type of learning community. The dates for the summit, I will pull those slides back up in a second, and we will go through that again. And let's see. We do not provide direct training and technical assistance for our tools, but we do have webinars that go with our tools. When you go to the resource guide, you'll see some short videos that accompany a number of our tools. And there is also the Opioid Response Network that I recommend. We have them listed in our guide in the intro. And they do provide technical assistance across the country, and they're just a fabulous resource. So the Opioid Response Network, I would certainly get in touch with if you're looking for some technical assistance. Great. Let's go to our slides, and then we'll just wrap up a little bit early today. Fabulous. So for our webinar next month, we are doing one on xylazine and what you need to know. We have speakers from the American College of Toxicology. They will be sharing some data that they've collected from toxicologists from across the country, and really kind of giving us a solid breakdown of what we need to know about xylazine in the drug supply, and what we can do from a harm reduction perspective. So please make sure you register for that. You can find that on our website and also in our digest. There is a link. Next slide. November 16th and 17th to answer that one person's question. So for NOPLS, the National Overdose Prevention Leadership Summit. Those are the dates, and you can go to overdoseleadershipsummit.org to register. And with that, we will wrap up for the day. So thank you so much for joining us. We hope you find these guides valuable. Please do click on the survey link that's in the chat right now and give us any feedback you have. And certainly if there are tools, resources that you think are super, super important, have been really helpful for you in your work, please let us know. We'd love to hear from you, and we can get it added to the guide for others across the country to benefit from in their communities. So thanks so much, everyone, and we'll see you next time.